Hello, my name is Candace Lake. I'm a registered nurse, and today I'm going to be presenting information regarding MIPS and the ways this system can impact our local community here in Austin, as well as nationwide. Today's presentation is going to cover a basic overview of MIPS, a comparison of Travis County with other peer counties. We're also going to study the data in these particular areas and identify areas where we can improve. We're then going to connect these areas of despair with available MIPS quality measures and improvement techniques and indicators. So what is MIPS? MIPS stands for Merit-Based Incentive Payment System, and it was developed by CMS, or the Centers for Medicare and Medicaid Services, as part of the MACRA legislature of 2015. So the MIPS program was created to accelerate the transition to alternative payment models, or APMs. And again, this was under the MACRA legislature. We're moving away from a volume to value mindset when it comes to reimbursing providers. So previously, providers were paid based off of the number of patients that they saw in a performance year. Now, CMS is recognizing 4 quality metrics that need to be achieved in order for a provider to receive reimbursement. So as you can see here, those 4 quality metrics are cost, improvement activities, quality, and promoting interoperability. To summarize, we want a low-cost, high-quality level of care. Improvement activities and promoting interoperability are getting the patient involved, providing them access to technology, giving them the opportunity to be engaged in their own care through the use of electronic health records, having the ability to share that with multiple providers, being able to communicate with a provider through technology. These are all performance measures that CMS is looking at when they're gauging how much a provider will be reimbursed. The purpose of MIPS is to drive improvement in care processes and health outcomes. This is something we can utilize at the local level to identify areas of despair and seek reimbursement to focus our efforts on improving these particular areas where we might be struggling in. As we'll see in the upcoming slides, Travis County, which encompasses the city of Austin, is overall a healthy city, but there are a few areas where we can seek improvement. Let's start by talking about who lives in Travis County along with the state of Texas. So these 2 graphs are showing us the ethnicities that are present here in Travis County and the state of Texas as a whole. In comparison, we can see that here in Travis County, 48% of our population is made up of non-Hispanic white individuals, followed by 33% Hispanic individuals. To our left, we see that the state of Texas has a similar representation, where these 2 ethnicities are heavily present in the state as a whole as well. Here we have some additional demographics just to continue to compare how Travis County stacks up to Texas as a whole. So here we'll see that we're looking at the percentage of particular age groups. We're taking a look at the percent of non-English proficient individuals, as well as the percentage of individuals that live in a rural area. Across the board, you can see that there really aren't too many outliers when it comes to comparing the state of Texas to Travis County, with the exception of the percentage of rural individuals. As we mentioned previously, Travis County is considered a metropolitan area, so it's not surprising that the state of Texas as a whole has a higher percentage of individuals living in a rural area. This next slide is going to give us a general picture of the overall healthiness of our population here in Travis County. So as you can see here, we have health outcomes and health factors. Health outcomes basically tell us how long people live on average within a community, while health factors represent things that we can do ourselves to live longer, such as exercise, physical inactivity, availability of primary care doctors. So as you can see in each of these charts, Travis County is scoring far beyond the national and state average, very close to scoring as the healthiest in the United States. We've talked about how Travis County compares within the state of Texas. Let's now take a closer look at how Travis County compares to peer counties in Salt Lake, Utah, and Denver, Colorado. The following data was obtained from the County Health Rankings of 2024 from the University of Wisconsin's Population Health Institute. So we're going to compare health behaviors between the following 3 locations. We can see Travis County in red is showing a lower percentage of mammogram screenings per year, along with a higher percentage of uninsured individuals. Also note that Travis County does have a lower percentage of alcohol-impaired driving deaths when compared to both locations, whereas Denver, Colorado seems to have the highest percentage when it comes to health behaviors regarding smoking, excessive drinking, teen births, and alcohol-impaired driving deaths. Next, we're going to utilize the same set of data to take a closer look at the clinical care that's available in these 3 locations. So once again, Travis County is in red, Denver is in blue, and Salt Lake is in white. We can see here that although Travis County does have an appropriate number of primary care providers, dentists, and mental health providers for our population, we do have a significantly higher number of preventable hospital stays per year compared to both Salt Lake and Denver. Let's take a closer look at preventable hospital stays. As mentioned in the previous slide, Travis County had a higher number of avoidable hospital admissions, despite a generally healthy population and availability of appropriate care providers. After comparing Travis County to Denver, Colorado, and nationwide averages, we can identify that this is an area that we need to improve upon. So, the line graph reflects a general downward trend of preventative hospital stays in all 3 locations. However, as we can see here, Travis County ranks consistently higher than the other locations from 2012 through 2021. In addition to preventable hospital admissions, we also noted from the data that Travis County had a lower percentage of mammogram screenings per year than the other 2 locations. So again, this is an interesting statistic, as Travis County, as previously mentioned, is healthy. It has plenty of availability of providers. So we're wondering, why is this? This data is helping us identify an area of despair that we can utilize the MIPS system to improve upon. In addition to a high percentage of preventable hospital stays, a low percentage of number of individuals participating in an annual mammogram screening, we're also noting that one of the additional areas where Travis County is scoring poorly is in the number of uninsured individuals when we're comparing to Denver and Salt Lake counties. So as we can see in this chart, the red circles is identified as Travis County, and over the course of 2008 through 2021, we can see that Travis County persistently scores higher in uninsured individuals compared to the other 2 locations. The good news is we're seeing an overall downward trend, but again, this is something that we should take a closer look into. So how can we utilize MIPS to seek reimbursement from improving upon the previously noted disparities here in Travis County? I referenced the CMS Improvement Activity and Quality Measure List of 2020 and identified the following. So we can address this concern of lower percentage of mammograms completed here in Travis County by measuring the percentage of women between the ages of 50 to 74 who have had a mammogram to screen for breast cancer in the 27 months prior to the end of the measurement period. So we can improve upon this by utilizing pre-visit planning to optimize preventative care. Providers can also utilize technology to flag when yearly services such as mammograms are due, and then use computerized provider order entry, for example, to have the order placed automatically for the individuals who fall into this particular category. Next, how can we utilize MIPS to decrease the number of preventable hospital readmissions? Again, I referenced the CMS Improvement Activity and Quality Measure List and identified the following existing quality measure. So by referencing the readmission rate for individuals age 65 and up who were hospitalized at a short stay acute care hospital and experienced any unplanned readmission for any cause within 30 days of discharge. So this would be the particular measure that we're going to reference when gauging whether or not we've improved upon this particular metric. Some quality improvement indicators or activities could be reflected by providing longitudinal care management to patients at high risk for adverse health outcome or harm. That could be utilized by using on-site practiced or shared care managers to proactively monitor and coordinate care for this high-risk group of patients who could potentially suffer an unplanned or unneeded hospital readmission. Finally, let's take a look at the uninsured individuals and how we can focus on this particular population and improve upon this identified disparity. So, unfortunately, I was unable to find a specific MIPS related quality activity or metric that could be identified. So, I'm going to suggest a basic nursing intervention, which would essentially be identifying patients without insurance. So, for example, if you are a nurse in a primary care provider's office, every patient that presents without insurance should be identified, offer resources and patient education regarding the opportunities and availability of insurance coverage to that particular individual. And then how we could follow up and gauge whether or not we've improved in this particular area is by taking a look at the percentage of identified patients who represent to that particular provider's office with insurance coverage after they're educated. In conclusion, those of us who are Travis County residents can likely all agree that it's a wonderful place to live. We've identified areas that we're very strong in. Overall, we're a very healthy population with a lot of wonderful opportunities to exercise, appropriate care providers, etc. We can recognize, though, that we do struggle in preventative care when it comes to annual mammograms, the number of preventable hospital stays, and uninsured individuals. Travis County is suffering in these particular areas. We can utilize MIPS to invest in these particular areas to offer a higher level of care at a lower cost for the individuals of Travis County. So that concludes the presentation. The next slide will have the resources that were utilized. Thank you for your time, and I hope that this was helpful.